Hi, my name is Sarah. I'm one of the nurses here at Sunrise. I've been here for over 5 years. Over the years, my role and responsibilities has changed quite often, just depending on what needs need to be met from the girls, what their health concerns are. Right now, my main role is to handle the psychotropic medications and work very closely with the psychiatrist. If medications happens to be something that your daughter is still striving to get right for her, maybe she's not on the right combination, maybe she's on too many meds, too few meds, whatever the case may be, Sunrise is a really good place for us to take care of that. We do have the luxury of time here. We're not like an inpatient hospital stay where we only have 7 to 10 days to figure out meds or whatever that stay would be. We have a couple of months to figure out if the medications are working for her. We also have the ability to make sure that she's on the right doses and that we're not skipping doses or taking things at the wrong time. We can make sure that she's taking those AM meds every single morning and we're taking those afternoon meds or whatever it is. And so we can really give it a good try to make sure she's on the regimen that the psychiatrist wants her on. We also have staff here 24 hours a day. So if we're trying to target depression or anxiety or whatever symptom we're trying to treat, we have the staff there able to observe and chart and pass on information to myself and then on to the psychiatrist to say whether or not we think those medications are working for her. We also have a treatment team where we can discuss her progress as well, and then again I would take that information on to the psychiatrist. I do sit in all of the sessions with the psychiatrist, and if your daughter happens to be an under-reporter of symptoms or an over-reporter of symptoms, or maybe she just lacks awareness of what her medications are doing for her, I'm able to sit in that session and again bring that information from the therapist, from the residential department, or even the peers in the milieu, and bring that information to the psychiatrist so he can get a true picture of what's going on with your daughter and her medications. We also have the level system here where girls can work through the levels and gain more privileges. And if it's age appropriate or situation appropriate, I would help with some education around your daughter's medication as she was progressing through our program. If she's getting ready to go to college or transition home or to a boarding school or whatever her situation is, I would be able to teach her about her medications and the importance of keeping a good regimen with her medications. During my time here at Sunrise, I've been able to see that sometimes when medication is the issue, that it's just not right for her and it's not efficiently working. Once we get that taken care of, then we have a lot more time and energy to spend on the other things that we need to be working on. And it's just so good to see when we get the medications handled.